Hey everyone, welcome back to the channel. In today's video, we're diving into an important health topic, jaundice. You might have heard of it, but do you really know what it is? Whether you're concerned about it for yourself or someone else, we're here to explain what jaundice is, how it happens, and what you can do about it. So, let's get started. Jaundice is a condition where your skin and the whites of your eyes turn yellow. It's not a disease itself, but rather a symptom of an underlying issue, typically related to the liver or blood. The yellow color comes from a substance called bilirubin. But what exactly is bilirubin, and why does it cause the yellow tint? Let's break it down. Bilirubin is a byproduct of the breakdown of red blood cells. When old red blood cells are broken down in the liver, they release hemoglobin, which is then converted into bilirubin. This bilirubin is normally processed by the liver and excreted in bile, helping with digestion. When there's a problem with how bilirubin is processed, either because the liver is not functioning properly or there's too much bilirubin being produced, it can build up in the blood and cause jaundice. There are three main causes of jaundice: prehepatic, hepatic, and posthepatic. Let's talk about these one by one. First up, prehepatic jaundice. This happens when there's an excessive breakdown of red blood cells. Conditions like hemolytic anemia or diseases like malaria can cause this. When too many red blood cells are destroyed too quickly, the liver can't process all the bilirubin fast enough, leading to jaundice. Next, we have hepatic jaundice, which is related to liver problems. If the liver itself is damaged, it can't process bilirubin properly. Conditions like hepatitis, cirrhosis, or liver cancer are common culprits here. Chronic liver diseases, especially cirrhosis, can scar the liver and disrupt its function, leading to a buildup of bilirubin. And finally, there's posthepatic jaundice. This happens when there's an obstruction in the bile ducts, which carry bile from the liver to the intestines. Gallstones or tumors can block the bile ducts, preventing bilirubin from being excreted properly. With bile trapped in the liver, bilirubin builds up in the blood and causes the characteristic yellowing of the skin and eyes. So now that we know the different causes, what are the signs of jaundice, and how can you tell if you or someone else has it? First, the most obvious sign is the yellowing of the skin and the whites of the eyes. But there are other symptoms that might show up too. You might notice darker urine, pale or clay-colored stools, and itching of the skin. If you or someone you know is experiencing jaundice, it's really important to see a doctor as soon as possible. The yellowing might just be the tip of the iceberg, and the underlying cause could be serious. To diagnose jaundice, doctors typically perform blood tests, such as a liver function test, to measure levels of bilirubin. They might also do imaging tests like an ultrasound or CT scan to check for any liver damage or bile duct blockages. Treatment for jaundice depends on the underlying cause. If the cause is a liver disease, like hepatitis, treating the infection might help. If it's due to a blockage, surgery might be needed to remove gallstones or tumors. In some cases, managing anemia or other blood disorders can help reduce the symptoms. Some jaundice cases are mild and go away on their own, but more serious causes require medical intervention. The key is to address the root cause as soon as possible. Now, let's talk about prevention. While you can't always prevent jaundice, there are things you can do to keep your liver healthy, like maintaining a balanced diet, staying hydrated, avoiding alcohol abuse, and getting vaccinated against hepatitis. Keeping an eye on your health and getting regular checkups can go a long way in preventing liver disease, which is often the cause of jaundice. To wrap things up, jaundice is a yellowing of the skin and eyes caused by a buildup of bilirubin in the blood. It can be caused by various conditions, ranging from liver diseases to blood disorders and bile duct obstructions. If you notice any signs of jaundice, don't hesitate to reach out to a healthcare professional for advice. Thanks for watching. If you found this video helpful, be sure to give it a thumbs up, leave a comment with your thoughts or any questions, and subscribe to the channel for more health-related content. Take care, and I'll see you in the next video.